Come in.
Good morning, Mrs. Carter. It's good to see you. What brings you in today?
Well, my shoulder's been bothering me for a while, but it's getting worse. And I think it has to do with me helping my son with his daily routines.
I'm really sorry to hear that. That sounds like it's really tough on you physically. Could you describe the pain and when it started, and also if anything makes it better or worse?
Yeah, it's a dull ache most of the time, but when I go to lift, the pain intensifies. Like if I'm helping David get up out of his chair or I'm helping him get dressed. I've been using ice packs, but they really have not helped much.
Okay, well, thank you for sharing all that. Let's go ahead and do a thorough shoulder exam today, and then based on everything you're saying, I think that it might be some kind of inflammation or strain in that shoulder.
That sounds good. I just really am worried about what's going to happen with David. You know, if I can't take care of him. I love him so much, but it's just getting harder and harder every day.
Yeah, I hear you, Eleanor. You have taken on such an enormous responsibility, and it's okay to say that it's overwhelming you. You are doing so much for David, and it's okay to feel exhausted, and it's completely understandable. And you aren't alone in this at all. We can work together to help you feel like your needs are being met as well as David's. And I can be there with you every step of the way.
That means so much. Sometimes I just don't think people understand what it's like taking care of somebody full time.
Well, I absolutely understand, and it's something that all healthcare providers need to recognize and support. So I want to help you plan, not just for your shoulder, but for both you and David in the long run. And if it's okay with you, I can help you explore different options like respite care and long-term planning. And I'll be here to help you figure out all of those steps. I'll be there with you for the entirety of your journey, because you are not in this alone. I'm here to help you.
Thank you so much. I've just held on for so very, very long.
Yeah. I really appreciate you sharing all of that with me today, Miss Eleanor. Let's go ahead and get that injection started, and then we can start figuring out a plan, okay? Hi, Mrs. Carter. It's good to see you again. How has your shoulder been since we gave you that injection and since you started physical therapy?
The injection helped a lot. Physical therapy's been tough, but I can tell it's getting better. And I'm trying to pace myself more.
Yeah, that's good. That's great. I'm really glad to hear that. It sounds like you're balancing both your health needs and David's needs very well. I know last time you came, we talked about how overwhelmed you felt. And I wanted to ask if you gave any more thought to planning for the future.
I have. I'm still scared, but I know I need to start thinking about David's guardianship and, you know, what supports he might need if I can't take care of him any longer.
Right. Well, I'm glad you started thinking about it. I know it's not easy to do, but we can break down all the steps together. I have some community programs and services in mind that I can connect you with. And then I also have some legal resources as far as for the guardianship as far as that goes, if you're interested.
Yeah, I'd really appreciate that. I don't even know what questions to ask.
Right, and that's perfectly okay. This is all very new to you, but we could go through all of that stuff together. I am going to make a written list for you with every step you need to take, and then also the trusted contacts that we have. And I will go through each of them with you together. You go as slow as you need to. You can ask plenty of questions. I will be there with you for every step, and we will get this figured out together.
Thank you. It's so great to have someone listen to me and not just send me off to try to figure it out on my own.
Yeah. Well, you don't have to do this alone, Eleanor. You take such great care of David, and it's our turn to take care of you. And you are not in this alone, so we're here to support you.